Dr. Gabriela Sherman, Chief Medical Officer at Los Robles Health System. Thank you so much for joining us tonight for the 10 by 10, where we'll discuss the COVID pandemic and working on the front lines. Before we get started, I'd like to thank our community for the outpouring of support, all the generosity, all of the cards. I know every time I walk down the hallways next to the ICU and read one of the heartwarming cards, it just raises my spirits and that of the entire treatment team.
Good evening. I'm Dr. Mark Susky. I'm the Chief of Staff at Los Robles Regional Medical Center. I'm a plastic surgeon, but in my role as Chief of Staff, I really want to encourage all of you that you shouldn't be fearful of coming to the hospital for any of your needs. So one of the unique things about my own personal experience with the community is that I grew up here. I actually attended Agoura High School. I went away for college, med school, and training, but I've come back into the community. So everything that occurs in this community is very personal to me, and I really appreciate the opportunity to talk to everybody tonight. You know, again, one of the biggest issues that everyone seems to have is the concern of, if I have to come to the hospital, am I going to be treated in a safe fashion? And again, you will be. And let me just explain a little bit how that works. You'll come into the hospital, you'll be met by a screener at the main entrance of either the hospital or the emergency department. They'll ask you a series of questions related to any potential exposure to COVID. You'll then get your temperature taken. You'll be brought into the hospital, and at that point, if there is a suspicion or a concern about COVID, you'll be placed into very specific wards in the hospital where you're isolated from non-COVID patients. The same occurs in the emergency department. The same occurs in the procedural suites, to include the operating room. And I think this can't be overstated too many times, but everyone who is COVID positive will not be interacting with patients who are COVID negative. So for those, the vast majority are going to be COVID negative patients. Again, you will not be interacting with any COVID positive patients.
We know that the COVID-19 pandemic has changed the way we deliver healthcare, likely forever. We've had to become very nimble and cognizant about the importance of patient safety during this difficult time. As a result of that, we've implemented very strict screening procedures in the hospital to make sure that it is absolutely safe to access care here on our campus. We do want you to know that the importance of getting regular healthcare maintenance and preventive healthcare during this time. Studies have shown that patients are delaying their screening mammograms and colonoscopies, and we don't want anyone to do that. We want you to know that it is absolutely safe to get healthcare here at Los Robles Health System. We know that patients will continue to access healthcare during this pandemic. We continue to see traumas as part of our Level 2 trauma program. We see heart attacks, stroke patients, and unfortunately, we've seen some patients who have waited too long to get healthcare. In fact, I recall a case of a recent stroke patient that came in that waited too long. He had symptoms that started several days ago, but unfortunately was scared to come to the hospital. As a result, he did suffer some debilitating disease processes that have resulted in him needing rehabilitation. Fortunately, he's on the road to recovery, but we don't want any of you to wait. We want you to know that it is safe to get your health care, so please come in. Please don't wait for your symptoms to progress. We are a Level 2 trauma center, a Level 3 NICU, and a comprehensive stroke center. As a result of that, our teams are constantly ready to deliver healthcare, whether in a pandemic or not. Our Leapfrog Hospital Safety Grade is a testament to our commitment to quality and patient safety here, always. We've been ranked a Leapfrog A Hospital Safety Grade 4 times in a row, the only one in Ventura County. That really means that we prioritize patient safety and quality in everything that we do. Leapfrog is a national database that ranks us on both process and outcome measures and benchmarks us against all hospitals across the country. As a result of that, you can be rest assured that it is safe to access care here at Los Robles.
So I also wanted to take this opportunity to discuss some of the awards that the hospital has won actually during the pandemic crisis itself. Again, as a medical director of the Wound Care Center, I'm happy to report that for the 4th year in a row, we've actually received an award that puts us in the top 10% of all wound care centers in the United States. So we're also making dramatic inroads in our research capability. Currently, we've been approved to be participants in over 16 national clinical trials, both in the cardiac and the interventional neurology spaces.
Despite the COVID pandemic, we continue to excel at the treatment of patients here across all sorts of service lines. Just recently, we were the first in the nation to do the Watchman Flex procedure along with a sister hospital in Texas. This allows patients with a very common condition called atrial fibrillation, which is an irregular heart rate, to live a completely normal life free of blood thinner medications.
I'm also happy to report that our hospital will be starting a graduate medical education program in July of 2021. That's very important because it really shows the quality of the medical staff that we have. We're going to be in a situation now where we'll be training the next generation of physicians. We'll be starting off with emergency medicine and internal medicine with the ultimate goal of incorporating further fields to include general surgery in the upcoming years. So some of the logistical expansions that are occurring at the hospital, again, even during this pandemic, the emergency department is going to be at least doubling its size. Radiology is also expanding. We're going to be getting a new helicopter port, which is important for all of the referrals that are coming in our trauma patients. And of course, we're also going to be improving our OR space with the development of a couple of what are referred to as hybrid operating rooms, which incorporate both the traditional operating room, but also with CAT scans that will allow interventional radiology procedures, both diagnostically and therapeutically, to be performed at the same time in the same space for our injured patients.
During a pandemic, we know that women will have a lot of questions when choosing the hospital that is best to deliver their baby. We have a commitment to high quality and patient safety always during our COVID-19 pandemic and not. In fact, we have a 24/7 in-house laborist program. That means that there is always an OBGYN that is here and ready to take care of you safely. In our Level 3 NICU, we have NICVIEW technology. What that does is it enables patients to stay very close with their parents throughout their hospitalization. Parents can remote in and see what is going on with their child at any hour of the day and rest assured that they're being cared for.
This has really, in my opinion, been the hospital's finest hour. And I would say that that includes all physicians, all nurses, all support personnel, administrators, and so forth. This has been very difficult times for all of us, but we've all really raised the bar, and I think it's important, again, to just state that to the community.
I'd like to thank you for this opportunity to connect with you virtually. We know that everything has changed during this pandemic, and it's even more important now than ever for our community to stay informed as it relates to their health care. As we discussed earlier today, I really want to make sure that nobody delays their health care maintenance, whether it's preventive screening with mammograms, colonoscopies, or even an immunization. Latest studies have talked about a twindemic now with both influenza and coronavirus, so don't delay getting a flu shot. And if you have any questions about accessing your healthcare, know that Los Robles is always here for you. We have a hotline, 877-888-5746. You can reach us anytime to ask questions about getting treatment done here or about finding a doctor in our community. Again, thank you so much, and from our family to yours, we wish you a happy, healthy, and safe holiday season.
Remember, together, we are TO Strong.